Okay, so how to rehabilitate problem hooves. Now we've got the music off, we can hear ourselves a bit better now, can't we? So yeah, basically we want to be able to get to these feet before we get to this stage where the feet are quite collapsed and crushed, but not only that, there are a variety of pathologies we can get at before they get out of hand. And it's important to recognise the early stages. So just to give a little bit of an insight into myself, I think I've met the majority of you in the past, but I'm a holder of multiple farrier qualifications, including corrective farrier qualifications from a variety of sources, from the Workshop Company of Farriers, the University of Central Lancashire, the Royal Veterinary College and the American Farriers Association. So, you know, wherever it is to be certified, I've done pretty much as I possibly can, really. There's quite an extensive amount of things to look through. I'm also a writer of articles as well. I've been published worldwide. Over 60 of them so far. I'm a frequent writer for Horse and Rider magazine. I've wrote also for Forge magazine, American Farriers Journal. But yeah, I'm a big believer in publishing stuff out there to help people help horses, basically. I'm a lecturing clinician for farrier and veterinary CPD, so continuing professional development, but I also do the occasional one for horse owners as well, and really appreciate you all coming to see me tonight. Lecturer at Harper and Keel Veterinary School, so I'll help to educate the vets of the future about hoof care and how to prevent issues occurring as well. And also, as I'm here tonight, to show off my new book. So enough about me, because you want to see the interesting stuff. So hoof rehab. Is it a simple process? Is it a case just going from that hoof to that hoof? Is it just a farrier's job to be able to strip that back into that sort of style of hoof there? Okay, so this is a rehabilitative process from 1 year, from here to here. And as we can see, that hoof on the left has got a complete, complicated toe sand crack. Okay, so it originated at the coronary band and descended down the hoof. That's why we define the sand crack. It's complete, so it's a full length of the hoof, and also it's complicated because it penetrates into the sensitive structures, and every time that horse moves and loads, it pinches in and right at the coronary band there. Okay, so is it a simple process to put it all together? Is it going from that to that? Or is there more to it? Is there more to it in terms of what else can we do to rehabilitate the hoof? Quite commonly an overlooked area is a diet of the horse and the influence of high sugar, how that can invoke an inflammatory response in the diet and in the body. And also the environment the horse is kept in, the soil qualities, the soil types, and the amount of movement they have. It's important to have a good static and dynamic assessment of a horse prior to working them, or as a constant repetitional practice as well. Again, if we can detect issues early, the better. There are a range of trimming protocols. Okay, so that means basically different ways of trimming feet, different ways of shoeing feet. I don't think there's any standardised method that works for every single hoof. You've got to really adapt your approach depending on what's in front of you. And any change we see in the hoof, we're going to see changes in the upper body as a compensatory pattern. Sometimes it can be a bit of a chicken and egg situation, whereas, you know, did the original issue start at the hoof, or did it start at the sacroiliac joint, at the suspensory, or did one cause the other? So it's important to recognise these things soon. And then in terms then of, well, what style of shoes do we apply? If we apply any, can we rehabilitate the hoof barefoot? Can we do it with hoof boots? And what variety and new styles are there out there to help us overcome these issues? So again, it comes down to spotting the minor changes. You pick up the feet every day, you assess the hoof every day, you clean the foot off every day after you bring the horse in. That has to be part of your daily practice. If you're doing any ridden work and you have some concerns about how your horse is going, well, it's quite easy now to record these flat work sessions on our smartphones. We've got a show jumping around, we can record on smartphones or on a tablet. You know, it's so easy to do now. We can have a huge catalogue of our horses and work, and that can be easily shared with any professional that comes to your horse. So whether it's a farrier, whether it's a vet or a physio, these little videos are very insightful into how we can apply our practices in terms of how we shoe or trim your horse. Sometimes unusual behaviour. Is there a reason why the horse doesn't want to bear weight on one particular limb more than the other? Is there a reason why you're losing canter transitions? Is there a reason why your horse is tripping up? You know, is this not usual behaviour for your horse? Maybe something's changed, or maybe they're compensating for it. And also reduce immunity. Is your horse getting more abscesses than normal? Is your horse getting thrush infection when previously had none? So is there a reason why that's developing? You know, is there something going on with endocrinopathic conditions, particularly if your horse is starting to age or starting to change condition of coat? So looking at the hoof wall to begin with, we're looking at the changes we can see here: diverging growth rings, cracks, long feet, chipped up. What are these defects developing? Why are they developing? Okay, is it down to just simply dietary changes that create the growth rings here? Well, as we can see, they diverge down in the toe. This would be indicative to me of a subclinical laminitic episode. This was a bit of a footsore horse, had been trimmed for a long time, and it's quite easy to see the changes in there would have had effect upon that as well. Feet are all chipped up around the base, some small grass cracks developing. The difference between a grass crack and a sand crack is that a grass cracks develop at the base of the hoof and grow upwards, the same way grass grows from the ground upwards. And that's how to differentiate between a grass and a sand crack. Okay, is this a result of trauma? Has the horse been constantly pawing at the ground? Has this horse had a traumatic trailer journey or anything like that? Well, I think it's unlikely looking at this because he hasn't really been out of the field. So is that a case there? Is there excessive growth? Yeah, well, yeah, there is excessive growth, excessive length of toe. And these changes in the hoof are there for us to monitor and also adapt our trim and management of the horse as well. What can we tell from the solear aspect, or the sole aspect of the hoof? Can we see any sort of little punctures on the soles? You know, sometimes you see little minute cracks and splits on there. That can be a sign of little stone punctures if the sole's getting quite thin or retracted. What is meant by the term retraction, you often see it when the environment changes. So we go from extreme wet of a winter to extreme dry of a spring. You'll see a lot in thoroughbred feet where they retract and suck up within themselves in the hoof. So it looks like there's a lot of concavity and a lot of foot to trim off. But the sole itself is quite flexible to the thumb. So they can usually be quite footsore. Sometimes as well, we can have lack of concavity. We've got a flat foot, low heels. We've got lack of concavity, lack of ability to absorb concussion. The horse's hoof sole should ideally be a concave shape. Okay, so it can provide grip, but also absorb concussion. If it's flat, lying low on the hoof, lack of bars developing, sole stretching out, feet again long. We need to pay attention to these changes. Consult with your hoof care provider about these and formulate a plan going forwards, because there's always a way to improve everything we see in front of us. The white line, the flexible junction between the sole and the hoof wall. Are you seeing any cavities developing? This is something you've got to be careful of going through into the winter if your horse is barefoot. You've got gravel tracks and stony tracks around where you keep your horses. You can sometimes see stones wedged in with a white line there. What happens then is if they push further up into the hoof, create cavities, bacteria can form, abscessation can then form, and also, in the worst case scenario, white line disease as well. So it's important to keep those stones out. The best way to do that, I feel, is to use a welder's wire brush, because they've got real strong bristles and they can really brush out, whereas your standard wire brush will snap off the bristles on time, and it's an easy way of keeping those stones and bacteria out of there. So as a consequence as well, is that hoof wall horn getting quite weak. So it's finding it hard to keep a shoe on. You're losing shoes more frequently than normal. We need to look at the white line and see if there's any changes there that may be causing this. Is there a change of posture in your horse? Okay, what we can see here is the horse standing up themselves, stood underneath themselves here. The cannon bones at 90 degrees to vertical. Really camped under there, so we're seeing some strain placed in the gluteals and the hamstrings there. Okay, is this down to pain relation higher up, or is this down to hoof imbalance down there? Or is it a bit of both? Quite often you get one, you'll get the other. Sometimes a change of posture can be down to weight gain, so horses find it quite difficult to stand in front with the extra bit of weight gain there as well, trying to adjust the posture. So it's important to constantly, if you can, photograph your horse stood square, even if you do it once a month, and to see if any change develop over time there. Minor ones don't really matter. But if we're getting to a point where we're seeing, suspension under strain, the sacroiliac under strain, and we're getting a reverse rotation of the pedal bone within the hoof, we need to take action, because otherwise it can lead to pathology, it can lead to lameness, and then of course, we lead to a rehabilitation program, which is eaten into your time of enjoying your horse. If we can prevent these issues developing, we all know the cost of horses now is extremely expensive. We don't really want to replace them. We want to be able to maintain what we have. Are you seeing poor performance in your horse? Okay. Is there a reason why your horse is stopping at fences? Is it pain related? Is it reactive to that arena surface you're riding on? Okay, we've got different standards of arena surface we will look at further in the presentation. What can we do as farriers to help with this? So from my perspective, what can we do given the information we've just been seeing about the certain aspects of the foot? What can we apply to help overcome these minor issues? I personally use gait analysis as a regular tool in my practice. It picks up things you don't see with the human eye. It allows us to create a record going forwards of how the horse was at one point compared to the future. But it does involve as well a team effort involving vets and physiotherapists. Okay, so you need a team that's going to work together rather than one that's going to work against each other. That sort of relationship is getting better, I've found over the years, as my years are advancing. Going back 20 years, there was a hostility between various groups, but now I think we all work together a lot easier now, particularly with the advent of smartphones. One of the good things about them is using things such as WhatsApp or voice notes or emails. We can send information to each other rapidly. Sometimes these conversations need to take place away from a horse owner because sometimes it's some difficult things to discuss, but it is for the betterment of your horse. Okay, so as long as you've got your permission to speak to each other, it really does help your horses. So when we've got an issue and a lameness developing, when is it time to keep your horse in and when can we keep them out? Well, realistically, unless we know the exact issue, if there's any severe lameness, keep them in until a vet or a farrier has seen them at the initial outset. Apply first aid support. So what that means is if you've got a horse coming with laminitis, apply a deep, thick shavings bed until they come. Usually you can get them in the same day or the next day, you know, in terms of who you call out. But a good first aid procedure is a deep shavings bed all the way to the door, so none of the space at the front. So if they've got the head over the door, they've still got the hoof support. Obviously contact your vet. Okay, if you do find that you bring your horse in and there's a nail sticking in the hoof, as tempting as it is, and it's the most natural thing to do not remove those hoof punctures. At the very least, take a photograph to send to your vet to give them a heads up, or your farrier a heads up of their journey out to you. A lot of the time myself, if there's a deep puncture in there, I wouldn't take them out myself, and I work with feet all day long because it's important we get them radiographs to establish where the exact depth of a puncture has gone to and whether there potentially any serious sensitive structure has been breached, such as a deep digital flexor tendon or the navicular bursa. Pulling them out without identifying the area that's affected can lead to severe infection and loss of the horse. It's also quite tempting to apply pain relief. Now, of course, whenever we're in pain, we just take paracetamol, ibuprofen, wouldn't think twice about it. But sometimes we need to see them at the worst, particularly if they've got an abscess. You know, there have been plenty of times where we've been out to an abscess and they've given the horse 2 Danilon or 2 Bute the night before and on the morning, and it's masked for lameness. You can't see any hoof reaction or any sort of sole pain expressed from the hoof testers. So it's important you don't administer pain relief until we've seen them, as tempting as it is. It gives us a bit of a better idea of how we're looking. But, however, if the condition is just minor, if it's something like a thrush infection or anything like that, or if a horse is recovering well from laminitis and the horse is quite stressful about being kept in, it is possible to create a small turnout area for them to go round in. They can do more harm than good sometimes by being kept in. And also if a stable is unsafe, you know, I'm sure we'd all like to have good brick stables, but some places I go to are falling down, particularly with the storms we're having. So if a stable isn't up to standard, then a small turnout area that's fenced off would be better than nothing. But ideally, it's always best to see a professional first before turnout. So when it comes to assessing these feet, we've got to a point there now where we've got a lameness and the pathology developed. We'd like to look at the static assessment of a hoof. So we're looking at the dorsal wall angle, we're looking at the heel angle, and we're looking at the difference between the two. So there's only 2 degrees difference there, so it's fairly normal. Okay, we're looking at the hoof pastern axis. So basically that is a line drop from the centre of a fetlock through the centre of a pastern and through the centre of a hoof. If it is aligned well, it has a normal hoof pastern axis. If the heels are collapsed, like the one on the title image, it's really collapsed, That's known as a broken back hoof pastern axis. Coincidentally, if you've got a hoof that's very upright with lots of heel, that's known as a broken forward hoof pastern axis. This is a system I like to use for a lot of the corrective cases I use. This is a system called Metron. So it looks quite similar to when you have your horse x-rayed. It's on a block and there's a board behind there, but unlike it being a radiograph board behind there, it's just a whiteboard. And these 4 screw heads provide calibration for determining the measures here when it's processed through software as well. So I always find it quite interesting as well, particularly when we want to compare over time. I like to share a lot of case studies on my Facebook, as I'm sure some of you have seen, or on my Instagram, because I believe in education and sharing these case studies is important, because it gives some other people hope as to terms, you know, when they have an issue with their own horses. So I do like to frequently share these case studies, and this has been found a fantastic way of doing this. This is my go-to static assessment of the hoof, using the Metron block to then assess the hoof. The Metron block can also be used for radiographs, and radiographs are important. Veterinary diagnostic imagery is important. We can't just rely on what we see in front of us, because that to me looks like a fairly normal hoof. Good hoof, barefoot hoof. Take a radiograph, that pedal bone's sitting quite low in that hoof. Okay, we've got a flat edge on the bottom there. So this particular hoof has historically had a keratoma, which is a benign tumour of the hoof wall, just removed there. As a consequence, the laminal indentation was compromised, and over time, because that has been compromised, we've got a slight rotation of the pedal bone, but that flat edge there has come from walking on a very flat sole. Okay, so this hoof required more protection than what barefoot could offer. So this horse in question had a sole plate attached to there, so it looks like it's basically the whole bottom of the hoof was attached with an aluminium plate with a rocker edge on there. But you can just see the value here now of having radiographs in some certain cases before we dive in with our knives and start nipping back feet. Radiographs as well are used to determine hoof balance. So we have here 2 views. On the left we have the dorsal palmar projection, and on the right the lateral medial projection. So the lateral medial projection, a few things we're looking at. We're looking at the palmar angle of the pedal bone, which is basically the angle the base of the pedal bone makes to the ground surface. And ideally it wants to be between 5 to 7 degrees. Okay, when we get down to being 0, it's called obviously the 0 palmar angle. When it starts to become, the ground line starts to become this sort of direction, what's known as a negative palmar angle. Okay, and that's usually associated with a low-heeled hoof, and is more commonly found in hind feet. That is referred to as a negative plantar angle, using the correct terminology. And you will find it a lot more likely to be in the hind feet than front feet, because the position of the hind foot and the hind limb, the way it loads upon there, is naturally a lower angle than it is in front. Okay, so you're quite more likely to see the reverse rotation of the pedal bone in hind feet than front. They do happen still a lot in front. Okay, so we look at the palmar angle. We're looking at the alignment of the digits. So this is what we call the digits. We have the proximal phalanx, middle phalanx, distal phalanx. So to tuck it into normal sort of terms, the long pastern, short pastern, pedal bone, and the navicular bone. But it's the alignment of these 3 bones we're really considering. Okay, so we do have a fairly sort of decent alignment there. Okay, when again we have broken back hoof pastern axis, that starts to rotate forward. And what happens then is, when you get it to rotate backwards upon itself, this area here, the top of the pedal joint, okay, the articular cartilage rubs together and over time starts to develop DJD, or coffin joint arthritis. Okay, if you've had a horse with an issue behind with a negative plantar angle, quite often the time they overload the front limbs, and as a consequence they eradicate that cartilage there, leading to DJD of the coffin joint. Okay, we're also looking at the lamellar zones, so basically the laminal indigitation between the hoof wall and the pedal bone, which locks together like a zip. It attaches the bone to the hoof wall. When we get rotation of the pedal bone, that gets pulled apart. So like you zip on your coat, it gets pulled apart. And it's very difficult for it to bind back in together then. Looking at the dorsal palmar projection, this is used, or can be used, as an assessment of medial-lateral balance. And what that refers to is if the heel heights of the inside and outside of the hoof are the same. Now the issue I find with dorsal palmar projections is, and because I've done a fair few of these over the years, I did a study at the Royal Vet College using cadaver limbs, loading them for a press on a force plate. It's very difficult to get a true image of the horse's stance because a lot of the time there'll be a rotation or a deviation at some point on the limb, so we'll naturally throw out an imbalance. Okay, it can be used as a guide, but not a definite. The way to also back up what you see is a video of a horse walking to you. See the first point of contact. So there is an imbalance. Usually, it's the first point of contact it makes, depending on the issue in front of you. But also an assessment of the hoof balance when picked up to be trimmed as well. Okay, so it's important you take a few approaches to establish whether medial lateral balance is present or an imbalance is present. So you can see the tilt and the alignment measures here. But yeah, use them with a pinch of salt. Very rarely you'll get good radiographs. And I work with a lot of vet practices, and some are very good at doing this view, and some are very bad, same as that one there. I'm not going to name which ones. And what we have here is obviously a very collapsed foot, but again, these are the values of taking radiographs. Okay, that's not a radiograph of that particular hoof, but it just gives an indication of what you're likely to see on that particular hoof. So this is the negative palmar angle in the front foot. Okay, we can see where the angle starts and where the rear of the pedal bone touches into the ground surface there. Okay, again, we can see the alignment's broken back. Okay, look at that line there. As we go through it, it's a broken back hoof past an axis. Okay, now this is a valuable radiograph to take because it helps to formulate the plan of where we're going to fit the brake over the shoe if we're going to fit a shoe. I know these can be improved barefoot, but you very rarely get above a 0 to 1 degree positive angulation from being barefoot, just the way these things go. A lot of the time you're going to need rigid pressure on there, and rigid pressure can come in the form of frog support pads or a supportive shoe with the rear third of the foot loaded up with some impression material, soft setting. But what that does then, it naturally increases that by 3 degrees from the outset. And that's before you trim toe back. Once you trim toe back as well and got the elevation there, you can create alignment of that line there, but also increase the palmar angle into a more positive plane. So between 3 and 5 degrees could easily be achieved there within an hour, you know. So what that instantly does then is, it takes strain off the deep digital flexor tendon, which passes down the rear of the limb, passes over the navicular bone and attaches onto the semilunar crescent of the pedal bone. Another thing to consider as well is the lower this angle is here, the lower the navicular area is as well. So the lower that goes down, the more force that is taken upon loading, and the more chance of navicular syndrome developing. When it comes to assessing the horse as well, I like to use gait analysis. So this is the process I do this with. I attach a Velcro sticker onto the hoof wall on the toe area of the front foot and on the lateral side of the hind foot. Attaching the sensors then to the Velcro. Very easy enough to attach, and switch them on with a remote. Okay, the horse is then trotted up, or walked and trotted up I should say. And this data has been fed into this remote and is then transferred into a tablet. Now it looks pretty much high tech, but this is very easy and quick to set up, to be honest, and it can give you a wealth of information about the stride. Now this is averaged over at least 20 strides. I like to see 40 strides because I think the more strides you can have, the more accurate your assessment can be. And it looks at various aspects of the stride. So we're looking here initially at the landing aspect, and we can see this is the left front and the right front. We can see different loading patterns between the left and right front. Okay, we also have landing locations there as well, and looks at the breakover. And yeah, so it's an invaluable insight. So let's see if we can get a video to play again. There we go, so you can see the process again. Attaching Velcro there, sticky back Velcro, and attaching sensors into there. This is a system called Hoofbeat. I've been using for a couple of years now, and again, it's great for rehabilitative cases because you can monitor their progress over time and gives us an insight into how they were at one point, and also adjust your shoeing protocol in terms of what you see there. The human eye can only pick up so much information. This picks up things you don't get to see but with your own eye.
Mark, is that something that you would do or the vet would do?
I do. Yeah, I do this. Yeah. I use it in conjunction with an AI setup as well. So whilst okay, it's not on this video here, but what I tend to do is attach those sensors to the hoof, and also where that camera is set up on that stand there, I use a system called SLAPE, which is an AI gait analysis software, which looks at pole and pelvic vertical displacement at trot. So basically it's a lameness locator effectively. And from using video footage, it sends all the data to a supercomputer in Sweden, and it comes back with some findings in terms of any pole or pelvic vertical displacement in trot. The good thing about the AI one is it can detect on the circle as well as a straight. This really is just for use on the straight, but it's very useful as far as, you know, the first point of contact in terms of whether there's any displacement there. So, for example, here we can see the landing location, how it differentiates between left front and right front. We've got toe first landing on the one hoof, and we have a lateral side landing on the left front. So that gives an indicator really where we need to trim effectively. So again, we can influence that with our trim and our shoeing. So I use all three in conjunction when it comes to corrected case. We have the Metron system on the blocks, the hoof beat system, and also the AI system. So you get a real head to toe static and dynamic assessment of your horse. And this is another cool feature I like, so I'll get both these playing. Basically, this creates animations. So we have animations here of the hind feet on this horse, well, the hind feet on both these images here. And again, this is an average of all the strides you've assessed. Okay, so you're looking again at hoof flight through the air. We've seen this view from above the horse. We wouldn't normally get the benefit of that view when we're assessing horses as well. So it looks at it from multiple perspectives. And that view there, that can be spun round in any sort of perspective. And you can spend all night looking at it. And I think, you know, it's a real interesting thing to use, really. And what I would like to do one day, and plan to do hopefully, is have a day where we can have an informative day where we get myself, a physio, and a saddle fitter, and go through one horse from head to toe all the way through the day, doing this assessment here so you can see the changes. I think that's something I would like to plan to do in the future. I think it'd be an interesting one for everybody to see. And then the physio can come in and do their thing, and the saddle fitter, and then maybe the dentist or the vet can do something, and from start to finish assessing the horse, showing the options that are available basically. So the problem we have with domestication of horses, okay, they're kept in a lot, particularly on some yards during the winter. Okay, don't get enough movement. We get horses that are racing as 2-year-olds before their spine and vertebrae are fully formed. And the horses that do live out on some bigger yards where they have to be sectioned into individual areas is they don't have biodiversity in their diet. They're just constantly eating grass. Short grass, which is high in sugar. Okay, which leads to inflammation, leads to metabolic issues, leads to a high iron uptake. Okay, so these are the three main issues I find with domestication is, starting horses too young, not just race horses. I also think the 4-year-old jumping classes are very difficult for horses to cope with. You don't see many of them still competing the age of 9 or 10. Yards that don't get enough turnout, enough movement. Now, there's been some studies done recently looking at supporting limb laminitis, which is basically when a horse has an injury on one particular limb and bears weight, and you want to take weight off the injured one. And you get supporting limb laminitis and the one that's overbearing the weight. But we also must be careful really how we approach this, because it's always good to keep your horse's weight down. But if every other horse weight was to get laminitis, I would see them, 70-80% of the horses would have laminitis. It's not just down to weight, because a horse can bear weight 3 times its own body weight on any particular hoof. Okay, so it comes down to blood supply shutdown from being kept in and not moving. You'll see laminitic changes on all 4 feet from a horse that's going to be kept on box rest with a severe injury, but it's more affected on the one that's bearing the weight. Okay, metabolic issues, endocrinopathic issues such as echometabolic syndrome and Cushing's disease, more correctly termed as pituitary pars intermediate dysfunction. They're the main reasons why you're getting laminitis. 90% of those come through endocrinopathic conditions. The other one is through ischemia, of lack of blood supply to a particular area. I hope I haven't lost you that one. So diet is the key to whole horse health. You have a healthy hindgut, you have a healthy diet, you have a healthy horse. And I've got illustrations that are in my book here, and we can see here the increased length of grass. It leads to the lower sugar levels. Okay, so less sugar is there, more sugar is down there. Okay, so don't think these starvation paddocks are actually helping your horses. You're better off having a longer grass stalk for the horses to eat because it's lower in sugar. We also have to be mindful of the environment they're kept in terms of the nutrient uptake. So this is the pH content of soil in relation to the uptake of various minerals. So iron is an inflammatory mineral, and as the pH lowers, that increases. Magnesium, an anti-inflammatory mineral, as you can see, more optimum around about 7.5 to 8. Okay, copper and zinc, natural antimicrobials, are better in lower quantities. Okay, so copper and zinc has to be in the correct ratio, because what happens if you get excessive iron, like you would there, it'll cancel out the zinc as well. So we can see when we get close to a pH of 7. Now, I won't expect you to understand all these. It's a bit more intense in here in terms of the mineral uptake. The 14 micro and macro minerals that the horse requires for their daily uptake is important really for their hoof health. And also looking at the analysis of the forage. So this is the hay analysis example. Okay, because what it tends to do is we quite often see people feeding horses balancers, which is fine, but you need to know what you're balancing to. Okay, because you could be over supplementing a certain area, under supplementing a certain area as well. It's important to know what your grass and hay forage, the determination of those as well. So we have the non-structural carbohydrates, which is a culmination of the water-soluble carbohydrates and starch combined. And if you have it less than 12%, that's ideal. 10 to 12% or under is ideal for metabolic prone horses. Anything above that is going to be too high in sugar. Quite often it's debated whether you should take the ESC and starch as a combination of the non-structural carbohydrates, but I see that personally as an assessment of feed. So your feeds are assessed using ether-soluble carbohydrates and starch. Your forage is water-soluble carbohydrates and starch combined. We're looking at the mineral levels of iron and any sort of magnesium levels as well, and copper and zinc. Now the exact levels, again, are all going to be in there. So you can see then, and also when we're assessing these, we're looking at the dry matter, not the air sample, because basically as it comes out of the forage, that's when it's all dried out. This is the column you want. That's not really particularly useful. But also it's quite useful for looking at the crude protein levels, you know, in terms of the expected workload of the horse. And also when it comes to feeding those horses that are overweight or particularly metabolic, and I keep coming back into these, I do work a lot of laminitic. If you've got a horse that's recurrent laminitic or is considered to be overweight or metabolic, feeding 1.5% of their body weight per day in hay. So, for example, a 500 kilogram horse should no more than 7.5 kilos a day of hay. And that is assessed whilst it is dry, because then what we want you to do is soak it for an hour and a half in cold water. Well, ideally, if you can, do hot water half an hour in cold. Any longer than 2 hours, you do start to leach nutrients, vital nutrients from the horse's diet. So you'll be leaching nutrients on this assessment of the hay analysis here. So if you are going to do that, you've got to feed a balancer then to resupplement that. Okay, so it's not a problem if you can't, you know, if you're soaking overnight or you've got to go to work, you can't wait around for 2 hours. You may just need a balancer to replace the nutrients that have been leached. And there are various balancers out there. I think the Forage Plus Winter Balance is quite good because it contains a lot of the antioxidants and anti-inflammatory minerals such as vitamin E, magnesium. The most readily consumed mineral of magnesium is magnesium oxide. However, you must be careful when feeding it because although it can be classed as a calmer as well as an anti-inflammatory, some horses go crazy on it and they just react badly to it. So it's a bit of a case of just testing it out really, to be honest. But deficiencies, which you see in the hoof wall, they flag up in here in terms of the white line, lack of calcium. Biotin looks at how shiny the hoof is on the outer aspect. The methionine, again, it's looking at the hoof wall quality. This is an amino acid, same as the lysine and the amino acid, which then looks at the sole area as well. So these are various deficiencies and how they flag up within the hoof. And then looking at the arena surfaces we work on as well, this is the big subject. I think it's safe to say all the little aspects we looked at so far, we could create a whole evening on each one. You know, this is going to be a general overshot tonight, looking at various aspects, and hopefully you can take away and learn more from there going on. The quality of arena surface can vary greatly. Now, if you're working at FEI level or Olympic level, they have specialists going around testing each arena, and if it's too firm or too soft, they treat the surface as applicable. But if you're on a livery yard which has got limited maintenance or limited quality of the arena surface, it can have a detrimental effect upon your horse's well-being. The certain carpet style arena surfaces I'm really not a fan of because they're too deep. I've got a colleague of mine who works up in York doing all the race horses up there, and he has stated that, you know, a lot of them come back with pelvic fractures from working on these carpet gallop sort of areas, and it's because it's so deep really, so it can lead to injury. There are three ways of looking at it. You have the ideal in the middle of all these, and then you have the extremes either way. So look at the firmness. If you have an arena that's not firm at all, well, you're going to create a lot of descent and a lot of pull on the upper limb. Ideal, you're going to have a concentric amount of force placed upon the hoof and limb when loading. If it's too firm, it has too much of a reaction on the soft tissues there. Okay, looking at the cushioning, similar sort of issue. You're going deep, you're going to strain your flexor tendons, suspensory ligament. Nice amount of cushioning, it's equal there. Too firm, you're getting a shock wave all through the coffin joint and pastern joint. Again, same thing with rebound. The rebound of it, you know, similar sort of concept. Too deep, you're straining the upper limb. Too firm, you're creating concussion to the lower limb joints. Cupping looks at how much the surface cups into the base of the hoof. Okay, so going too deep again, descends that navicular bone into the surface, the flexor tendons into the surface. Nice amount there, nice amount of descent to cupping. Again, too firm, and should create shock waves for those joints as well. So we have the landing and breakover phases of the stride. Looking at grip. Okay, when there's a lack of grip, shock wave in there as well. When we go to purchase off, you know, we've got too firm a surface and we've got enough bite in there to propel the horse forward. So what can I influence then? We've talked a lot about the preparation. We've talked a lot about the diet, the environment. So I know you've all come to see farriery stuff tonight. So this is basically, I'll show you a couple of examples and how teamwork is vital. So this is the horse that's had a keratoma in his back feet from double barren stable walls over a number of times. This horse has been lame for 2 years. A very good quality horse, I must say. And it's been spent an awful lot of money. I won't say exact amount, but it was an awful lot of money on trying to get this horse right, and was still lame. I was called in as a last chance resort, and this is what I found. I found a real, you know, puff up there of a coronary band. We can see a split there, and a reinforced plate there because the tumour, or the benign tumour of the keratoma, was removed, and it wasn't really held together particularly well. So there's a crack developing above this reinforcement plate. I've been treated with iodine spray, which would sting like hell, and he was trying to kick people when they were trying to spray it. You know, you can see why. So when it comes to rehabilitating the feet, this is where a farrier's perspective can really come in now. So you can take away the issues and try to normalise the hoof. For me, the first thing we needed to do was to stop that open and closing. Okay, so what I did to apply on there is a real wide bar shoe with some leather pad underneath and some packing. Applied a hoof cast around there, all wrapped all around the hoof, so similar to a cast we get in our arms and our legs to help hold it in position. Put some antifungal clay in there before it was wrapped up. And over time, this horse started to improve further and further. He's a show jumping stallion, and now, as we can see now, this is the hoof now, and lost all of that sort of puffiness around there now, and the limb looks like it's attached to the hoof rather than offset it. And I'm really pleased to say he's back jumping now, which I never thought. It took 3 years for him to come back jumping, and now he's grade A. You know, he got to grade A, so I'm really delighted with that. I've got a few white highlights on the side of my head. He's caused most of them. Similarly, laminitis is a big thing I deal with. Okay, I deal with a lot of laminitic referrals, and what we're trying to do here from a farrier perspective is we're entrusting the vet to treat the condition from a medical perspective. We're trying to improve the outer shell of the hoof, okay, and provide a bit more protection and comfort around there. So this is a rotated pedal bone with a gas shadow in there, limited sole depth, descent of the digits, a lot of pain for this horse. So in order to arrest that separation, historically we would have removed all of that with a Dremel, and that's what's known as a resection. I'm not a big fan of resection because I think you strip away all that protection, there's nowhere for that pedal bone to go other than descend and get worse. I tend to put a huge deep rasp mark in, which you can see there, what we call a horizontal groove, probably about 10 mil below the coronary band. It goes in really deep. You almost, well, you do hit blood at times, so you know you've gone deep enough. And what it does, it separates that gas shadow in, reduces the descent and pull on the coronary band at the toe area, because what you'll see with laminitic is it will dip in the toe when you put your thumb across there. So reduce the tension there, allows some healthy straight growth, arrests that separation, and over time we increase the sole depth, reduce the founder distance, and derotate that pedal bone using clogs and casts. I'm a huge fan of clogs and casts, where these are applied with pilot holes drilled through the hoof wall, so where you would normally stick your hoof wall nails when you're applying a normal steel shoe. Impression material is placed in the rear half of the hoof only, okay, because that's the area that needs support. We need to float the front half. Apply antifungal clay because you've got no access to get in there and clean that out. And then we're attaching these with screws, and these can be put on really, really fast, you know, so the horses get comfort. Historically, we used to glue shoes on, and still you can still use glue on shoes without a doubt. However, if the glue takes about 15 minutes to set, and you get to 12 minutes and that horse snatches away and that glue cracks, you've got to start it all over again. Bad for our mental health, bad for the horse's welfare. So just by drilling a couple of holes in, popping some screws in, clamping them on, they can put the foot down and rest. They can put the foot down and rest, then we can apply a cast around there, which binds a laminae from front to back, side to side. And what this tends to do as well is it reduces the tensile forces acting upon the laminae by a good 40%. That's proven by a friend of mine at University of Central Lancashire. And by fitting this clog, we're fitting a breakover. And before we discuss breakover, that's the point at which a hoof takes off from the ground. We can fit that in alignment with the tip of the pedal bone there. So we've got biomechanical efficiency of that coffin joint. And as that hoof is now improved and the horse is sound enough pain relief, we can then switch into something a bit more normal, well, fairly normal. It's a heart bar shoe, aluminium shoe with the edges all beveled off to complement and copy the biomechanic efficiency of the clog. A mesh pad is applied with some impression material to provide actually a little bit of sole protection, but it's a good step down from that to that. Changes to posture. This leads to changes to soft tissue higher up. Okay, so we showed you that example earlier of that horse stood under, all the strain being put on the gluteals and hamstrings on the SI and on the suspensories. Now, just a couple of months later, from June to August, we come to see the horse. Well, the horse starts to the vertical. I mean, you may not see it quite so easily on this particular setup, but there's reduced tension along here as well. Okay, so we reduce the tension simply by applying some frog support pads and getting the posture there in a better position. Pelvic rotations as well aren't quite as common, but they can lead to issues as well, particularly when cantering in circles or trying to work in circles. So again, this may not be quite so evident on this particular wall, but you can see a pre-shoeing asymmetry that the tubercocci of the pelvis being higher up than that side. Again, by leveling it off by using a retractive trim and a graduated frog support pad on this one and a flat one on this one, we've got a level pelvic area. We have the tubercocci the same height. This was assessed using an AI gait analysis, which of course threw out an asymmetry of the left hind and right front. Yeah, we quite often have diagonal asymmetry, which then develops, and then by simply doing that, when we repeated the assessment, the asymmetry got eradicated. So again, this is something that was, both of these were referred to me by a veterinary physiotherapist rather than an actual veterinary surgeon. So I was able to make these changes myself and improve the horse's going just by assessing the horse. It all comes down to just assessing what you have in front of you and making the best of what you've got in front of you. A lot of these conformational issues cannot be changed after the age of 6 months. You've simply got to stop them getting worse and keep them in the point of tolerance so it's not going to create any issues for the horse. And of course, if you have corrective shoes, you want to be able to maintain them as well. And this is an important aspect of the rehabilitative process. We want to be able to prevent shoe loss. So the example here on the left, the overreach boot is too small. Okay, it doesn't cover the heel of a shoe or the heels of a horse. All that's doing is keeping the pastern warm. Okay, so you may as well not bother. The issue I find with overreach boots, even if you have ones of sufficient length, if you've got a horse with hardly any feather, they can ride up the pastern, particularly when they're trotting. The way to do that is put your overreach boot on. If you can slide up and down as a horse is standing there, well, the horse goes for a trot in the paddock. That's going to lift up, expose the heel branches, and lead to potential shoe loss. Got a few tricks up my sleeve. The first one is using a sausage boot above it. By using a sausage boot, it keeps it clamped down. Can't ride up. Okay, can't ride up. It's not going to collide. You've got full-time protection. Okay. One of the things to be careful, of course, with overreach boots is watching out for rubs. You've got to make sure, particularly how wet it's been recently, it doesn't rub. It's not too tight. If it does start to get tight, use some Vaseline around the rim, or give them a little break from it. I'd much rather not see a rub than a lost shoe, personally. So I'd much rather the horse that was put first. And we need to make sure we don't get rubbing along there. Sheep wire should be nowhere near horses. Okay, it's for sheep, not for horses, because it's a perfect size for them to get their hoof into and pull a shoe off. Okay, I know it's why some people do have sheep wire to keep dogs out, and they go through bridle paths next door, foot paths next door, but that's going to be your issue. So if that's going to be a constant issue, getting a strip of electric fencing, bringing it away from there, so you can still have protection from anybody else getting in there that shouldn't be in there, but it stops them getting caught in there as well. Lost shoe is one convenience. The lost heel bulb is something a lot more dramatic, and I've seen it. Okay. What about going barefoot? Okay, so we talked a lot about shoes, and barefoot is absolutely fine in the right circumstance, I feel. I've been working a lot of barefoot horses, and it's not just a case of just taking off shoes and going barefoot. It takes a lot of investment and time into the diet and the setup and the turnout and everything else. One of the pros of it, of course, is natural hoof function. You can't deny applying a steel shoe to a hoof restricts natural hoof function. It is absolutely the case. Okay, but also allows us as well, by being barefoot, to spot these changes to the hoof early. Think of that example earlier with that hoof wall and the change we saw on there. We may still see those changes with a shod foot, but they flag up much earlier on a barefoot hoof. You don't got to worry about any more lost shoes. That's another advantage. And in some surfaces, you do have increased grip. Some certain roads, the horse have more grip being barefoot than being shod, unless you're going to start then applying tungsten pins into shoes, non-zip nails, which then have their own issues on joints as well, okay, if applied incorrectly. What are the cons? Okay, what the cons of going barefoot is, there's no protection of the white line. So stones get wedged into that white line, as I described earlier, potentially leading to abscessation. I'd say 8 out of 10 abscesses I see are within the white line, so it would help prevent those. There is insufficient stimulation of the digital cushion. That's quite a controversial one to say, really, because you'd think, well, taking an open heel shoe off and taking them barefoot, they're going to stimulate the digital cushion even more. But if you've got a low-heeled foot, that requires the soft tissue development at the rear of the foot. A positive pressure from something like a frog support pad or supportive shoe, coupled with hoof packing, can create a development of the digital cushion, increase the palmar angle of the pedal bone, and take tension off the deep digital flexor tendon. And of course, naturally there'll be lack of protection on some surfaces. So when you've got very abrasive stony tracks, you have lack of protection against those, lack of protection against the roads. There would still be some argument as to the fact that some of the subclinical foot soreness can come from a high sugar diet, throwing up slight little inflammations in the hoof as well. So it's about assessing each situation with its own merits and acting upon it. If I could have my own way, I'd have every horse barefoot, but that's not possibly the case. Track systems is a big topic now, and anybody here have a track system? Yeah, great. It's good to see. They can be very useful for horses that are stiff and arthritic. I often feel that horses over the age of 15, 16, if you want to extend their years, they are better out and better moving more. Okay, increased movement increases more blood flow. As we described before with the horse on box dress supporting limb laminitis, it develops a lack of movement. But what do you do if a horse has got a severed tendon? You know, that is why they develop. We're going to have to start looking in the future how we can get these horses into some sort of device that can stimulate blood flow. I think when you get these horses on box dress, to help prevent those issues developing. You can also make use of less acreage within the paddocks by having a track system. And it's important first to establish the horse's current diet status. So again, we need to have an assessment of the macro and micro minerals, how inflammatory the diet is at the moment, and then make the changes to that as we progress. So those are pros, and these are the cons. Okay, if you're going to be on a track system with other horses, we may have horses fighting. Okay, it goes without saying. There's a reason why some yards have individual turnout. Some horses we know ourselves couldn't really be turned out together. The danger of infections for those who compromise immunity. So if you're living on the track system, you're barefoot, and you've got some sort of subclinical PPID developing, and you get compromised immunity, for various reasons, there's more chance of thrush and bacteria getting in there creating hoof abscesses. You've got areas where it's going to be high iron uptake from a certain amount of stoils. It's going to be quite inflammatory as well. And if we are going to keep them on a track system, we're going to have to get really used to a site like this during the winter, unless you've got spare tracks to use. So I don't think all of us could cope with that. Some of us are absolutely fine with that. We're not going to be able to really clip the horses or anything like that. And to get them ready to be ridden in that, it's going to be a bit of a challenge as well. The stony surfaces there, again, it can lead to stones getting stuck in the white line. But some horses do thrive upon it. And I think you've got to take each one individually as an individual case. The beauty of horses, and that's what I love about them really, is the fact that not one size fits all. Not one shoe fixes everything. Not one trim fixes everything. Not one hoof boot fixes everything. There's always something. There's always one horse to teach you a lesson. So again, some horses thrive upon this environment. Some horses do terrible in it. And rehabilitation of the hoof using hoof boots. Now, this is something that's going to develop. If I'm going to use a crystal ball to develop the future, I think this is something that's going to develop more over time. I think, could this potentially replace shoes? Well, I think it's a strong possibility, particularly because of the designs now are getting much better. Before we used to have the big clumpy cavellos that used to spin and twist on the hoof, but now we've got a whole variety of different designs, and I think these are going to improve further. Okay, so these can be applied when you're getting horse tacked up. Apply the hoof boots to go and hack and then take them off, leave them barefoot the rest of the time, particularly because we have a lack of farriers coming through now. We're going to see shoeing prices increase significantly, I think, in time. So it may be potentially a more cost-effective solution. So, okay, a lot of these will probably cost in the region £150 to £200, which sounds like a lot of money. But by the time you've had half a dozen sets of shoes, that's far cheaper, and also probably far more efficient. We don't have to worry about lost shoes or anything like that. We can sort of get in there, clean feet out easier. I do offer a hoof boot fitting service for my clients, so I've got a variety of different style boots, so you can get the exact size and exact fit, and they can also be modified as well. So when you get them in, I can, one side needs beveling off more, or one side needs a bit of a lift up. There are various options out there, so it is possible to rehabilitate the hoof barefoot and using hoof boots. The cogs in the machine, well, the way I look at it is, it's not just down to how the farrier trims the hoof and shoes a foot or trims a foot. As we established from the outset, there are many aspects to it. The horse's diet, you need to have a good groom as well, who's going to be able to implement what you're suggesting today. You need to have a good saddle fit, and the incorrect fitting saddle leads to changes in the hoof. Good quality physiotherapist, who can work with your vet and your farrier, working together, can create a healthy hoof and a full rehabilitation of the hoof itself. And if you want to learn more about that, now's your chance. And that's it for my presentation. I'm more than welcome to take any questions you have about the presentation or about any horse of your own, so feel free.
I've got a horse that's been diagnosed with, she just wasn't right for ages, but never lame. No vet could pick it up or anything like that, but I just felt she wasn't going forward right in my limited experience. But had a farrier, and this was not against farriers, had the same farrier since I got it from Ireland, and the feet were quite flat. But over time, you don't notice these things occur. Eventually, I took her to Pool House for a lameness, and she's got PSD, both, well, the right hindwork she's got tear, and in the left she's got inflammation. But immediately it was picked up there, and they used Grant Moon, that she had MPA, and she's got MPA in all four. My thing is, I had her shot every 6 weeks. I've got photos of when she came from Ireland, so I took photos of her feet, and I should have seen it. But what's annoyed me is, did her feet going so much flatter and the farrier not noticing or saying, actually, when I've seen the x-rays, what, my God, what a difference an x-ray makes. How can that just happen to now that she's only just gone 7, that she's got PSD? Do you know what I mean? Is the MPA cause the PSD, or does the PSD cause the MPA? It's like chicken and egg thing.
Yeah, I think as well, particularly as the horse ages, I think in the juvenile stage, we have got less force and less weight upon the limbs. But as they get to beyond the age of 5, 6, 7, you know, the frame starts to fill out, and also their workload probably increases a bit more. Not that I don't think any of us really overwork our horses, to be honest. I think a lot of us, you know, not that particular thing, but it's amazing what they can cope with. But at some point, it is what we call a risk factor. So when you see those small changes developing in terms of their performance, this is why I always ask when I go to my clients, how's your horse been going? And that's why I want to see videos of the horses at work, you know, because sometimes, you know, it's not down to the owner's responsibility to see these changes. I feel that the physio, the farrier and the vet, we're the ones that should really see these things. Absolutely. And yeah, exactly. And you know, putting farriers on the line here, you see your farrier every 6 weeks or so. It's a most regular occurrence. You're going to see a professional. The other time you see a vet maybe once a year. You know, best of luck. You know, hopefully just for flu and tet jabs, and you know, for your teeth, for your dentist again. Physio maybe a little bit more frequently, but your farrier as well. I always say to people, I'm not going to give you good news, I'm going to give you honest news. And I've put pads on horses as preventative to prevent an issue occurring before it's there, because it's better to shut the door before it bolts, before it gets to the point where, you know, you're at a point now we've got to rehabilitate. You've got to drive the Pool House and back every 6 weeks. And you've got to go then fund their third holiday home in Barbados, you know. So.
Nobody at Pool House has said your farrier has done this or whatever, but what annoys me, I pay 90 quid every 6 weeks to get my horse shod. I won't say who my farrier is. I do like him, don't get me wrong, but surely he should see that, or does he just come, spend 40 minutes and the feet done? There's farriers and there's farriers, isn't there?
It's a tricky one really, because effectively it comes down to really whether you, as a professional, whether you want to deliver that news like a lot of the time, you know what I mean? I mean, to be fair, you may feel like, oh, you know, I don't put pads on in case, you know, you pull the shoe off, or, you know, because I know the bill's going to go from £90 to £250. You know, it's a big bill to drop on somebody, you know. But if we can see it as a preventative, I think a lot more people, a lot more farriers going forward will be putting these on as preventatives. Just because they see the results. And again, that's why I frequently share so many things online as a complete geek, showing these, you know, pathologies, because it shows you what you can prevent and how much, and then results you can get from the horses. Not just like, you know, okay, I showed you an example of a show jumping horse. It doesn't matter whether they're show jumping. It doesn't matter if they're just happy hackers. Everybody's horse is priceless to them, and we have to treat them as that. You know, to treat them as a family. You know, so but I mean, obviously it's something where your farrier will probably have to now engage with Paul House and work together with them. And you know, that is where you know, unless you're going to see Grant every 6 weeks, that's where it could go progress on from there, really. And some farriers I find are easy to work with than others. You know, I quite often have farriers come with me when it comes to do a referral, and we'll say, for example, working on laminated together. Some just don't want to know, and some just say to me, "You fix it, I'll be back when it's fixed." You know what I mean? So you get a variety of situations, and I think, like all of us, some of us are more approachable than others, and yeah, it's always a tricky old situation. I think I've got it under wraps. But there's always a fresh situation to throw you under the bus, you know what I mean?
But I think most people, although maybe not, you know, ignorance is bliss, I think. But to me, if I was told, or if you knew, I'd much prefer to go down the route of prevention, because prevention.
I think we all would, wouldn't we? We all would, absolutely.
Yeah. So can you come see my horse? That is the way to do. You didn't answer me.
I'm waiting for all extra questions.
If your horse does come in, like you said earlier on, with a foreign body, a foreign thing sticking out of his hoof,
Yeah.
if there's a danger of it going further in, would it be best to pull it out? Or
Fantastic question, yeah, because sometimes you can bring a horse in with a nail stuck in the hoof, and you think, oh, a few more steps, that nail's going to go further in. And what may be quite a good thing to do as a first aid kit, if your horse is your horse shod?
No.
Okay. If you've got a friend who's got a horse with similar sort of size feet, get a couple of old shoes, tape them together so you create a vertical depth so that you can then tape onto the bottom of the foot. So effectively then it can't be pushed in. If your horse is shod, tape a couple of extra on there, and it makes use of the scrap shoes then effectively, you know what I mean? So I know it's probably going to the extreme, but I always think in life, if you prepare for the worst, anything above it's always a bonus. So that's the way I prevent that. Which of course, you may not be thinking of emergency at the time, but that's something you could probably all take from tonight. Get yourself a couple of spare shoes in case something like that happens. So basically, imagine you get two normal shoes, tape them together, so you got one on top of the other. Place them on the hoof, wrap around and tape around on the hoof as if you're going to nail it on yourself, so to speak. So yeah, basically increasing the thickness. Yeah, yeah,
I've got a nail and I managed to bend the nail
yeah.
so that it was lying flush.
That
Don't go in anymore.
no, I know, but it could be okay.
It was a crappy nail, so it's quite soft to burn.
That's all right then. But sometimes, of course, we bend it either way. We could be ripping flexor tendons. You know what I mean? But you know, each nail's individual. And I think because we know the length of these nails, we know the age of them, we've sort of got an idea as to what we can get away with, can't we? You know what I mean? Bit of common sense. Yeah.
Fencing tack.
Yeah.
So it got an end on it, and
Yeah.
it was, you know, we knew it was new, and we knew how long it was.
Exactly that.
Right,
No
set
exact
that,
length.
photograph it,
Yeah.
and then they did X-ray first.
Yeah.
Make sure there was no damage.
Sometimes, though, if the X-ray with nails out, you can't see where the penetration area is. Obviously, fine in your example, but that's the reason why I like to see radiographs, just in case it has gone to something like a bursa.
Yearling as well, so it was like kind of hard.
Oh, yeah, yeah.
Mark, what do you do if it's a case where somebody bought a horse in it about a month ago and the shoe is hanging on by one nail and wasn't sure what to do, and we did try to get it off, and I thought, but it was like proper hooks in, and I thought, no.
So the shoe is hanging on by one nail. Were you able to move the shoe by hand?
Yes, you could.
Okay, so if you could move it round to position where it could be stood upon, but then take round that position until it could be took off.
Right.
There is also how to remove a shoe in emergency within there, which you would have known.
I haven't read that.
You've read it from cover to cover.
But you need a piece of proper thing.
Yeah, you do some proper tools, and you can easily get those fairly cheaply from various saddleries. You know, ones are imported from Asia, shall we say, you know, you'll get a kit for about £30, £40.
Had a lost shoe, Mark.
Well, there's always a first time. Don't be careful what you wish for.
I never had a lost shoe until we had the shoes with pads, and then they're a lot easier to lose, aren't they?
They can be, particularly when they're wet going, because of all the suction effects
Yeah.
on soft going. I tend to, as much as I can, leave pads out this time of year. You know, unless you absolutely have to, unless it's a posture adaptation. If it's a hard ground, I take them out this time of year, put them back on in the spring ahead of the hard ground. That's just my general rule of thumb. Jane?
Okay, so as a trainer, I think I am, but anyway, that could be disputed. But anyway, so I quite often see problems before they occur, right? Simply by the horse's way of going.
Yeah.
Quite often, the biggest one I see not going forwards, and I go, my horse is lazy. Right. I see that as the horse has got an issue.
Yeah.
Always see it as an issue. There could be lots of things going on. That's pretty clinical to me. So, but my problem is when you suggest it, they just shut you down.
The rider shuts you down.
Oh, yes.
Okay.
Oh, yeah. No, it's just lazy.
It could also be down to the arena surface not suiting the horse.
Absolutely.
You know, that is a big factor.
Absolutely.
Mm.
But, you know, it's just interesting what you're saying. It absolutely can be preclinical, something going on, can't it? Either they don't want to push with the hind legs because there's something going on.
Yeah. Yeah.
You know, MPA, for instance, laminitis, preclinical.
Yeah.
Could be definitely that, can't it?
Absolutely.
You know, it was just not a question as such, but just an observation.
Yeah. And that's where, again, you need a good vet and farrier and physio team who are happy to communicate with each other. Whereas, like, you know, if I've seen a horse I think needs to see the physio, and I've got them all first name, turn saved on my phone, I can drop a message saying, look, this is what I found, this is how I shot him, tell me what you find when you go to him, you know, because then I think the more information we can get, the better, you know.
Not every vet's blame this.
No.
This is the problem, and nobody knows who my vet is, and you know, I would never put my vets down. But I think it comes down to each of us individually, because you're riding your horse. I've been to e-shop clinics, and I've seen different guys training different people, and you can look and you can clearly see that a horse is late. Now, like Jane was saying, God forbid, she says, actually, don't ride this horse. You're in a no-win, and you probably are a farrier as well. Where do you, whatever. It is awful, isn't it? But I think it's down to
dreadful.
each
It's
individual.
dreadful to have to impart that information.
But
You can see an unlevelness or not going forward, or an unlevelness, you know, in the gait or whatever.
What do you do?
It's the worst news you can actually pass on.
You've got to tell them, because otherwise, I mean, you've got to tell them.
I don't think about their pocket, I think about...
Yeah, the horse's interest comes first, okay? And if you don't...
Yes.
They might then go home and
Yeah.
Well, I might
Yeah.
never have you again.
Might just
Yeah.
change train.
Yeah.
But it is difficult, isn't it? So that's what you're on about, that gait analysis.
Yeah.
So how much does it cost to view a map and do a lameness analysis?
Well, basically, the gait analysis, it looks at the foot flights, the hoof contact, and there's asymmetry present. We have to treat the walk gait as, you know, it's good for assessing the footfall and contact. We can't really look at left and right symmetry because walk's not a symmetrical gait, whereas trot is. But by using that gait analysis itself, you know, you're probably talking £75, £80 for analysis assessment. But as well, you've got that can be repeated at any point. And I mean, the trouble is, of course, in example of yourself, you've gone to the vets now and it's on your record. But if you're seeing minor issues, we can put them on a gait analysis, establish them. The insurance companies, you know, they don't see that just yet. You know what I mean? So it's pre to that. It's pre to that.
Sorry?
When they do that at Poor House, they do it with Bryson. They put the...
When I went there, they spent an hour and a half. But obviously what Mark's saying, which is very clever, I haven't got insurance anyway, but it's on your vet's record. Whereas I suppose if you go to Mark, and I'll think about this in the future, I'm not going to tell you who my vet is, you're not going to know, so it's never going to be on your record.
Well, I think the insurance companies are actually quite see it as a good preventative as well, though, would you know what I mean? I mean, they can see when you took every reasonable step to prevent an issue occurring.
And also keep the gait efficient.
Exactly that, yeah.
The correct trimming and then
I mean, claims are all good and well, but if things work out well, great. But if it don't, and you've got to replace a horse, we know how much they cost these days. You know, it doesn't come cheap. So prevention is always the best way, which I think we all know.
Do you do that for anybody else? You charge people other than your own clients to do that gait analysis?
I have done it for other farrier clients, other farriers. Predominantly my own, but I do outside ones as well. I go to a rehab yard and I do a few there that come in for an assessment. So we go there every couple of weeks and have some come in for assessment and they go back to wherever part of the country they come from all over the place. Yeah.
Yeah, you could have clinics for that.
That's what I'm thinking. As I say, as I stated earlier, doing like a whole day clinic, you know, where you could have like a physio in, me doing this, go analysis. I think it'd be on one horse in and just go through it all day. I think it'd be an interesting sort of day. So we'll see if I get the elusive 5 minutes to set up something like that. I might do that.
I mean, I found a really good, she's multi-skeletal, whatever, lady that I've had that many different back people with my mare because I couldn't get to the thing. Saddles, 3 saddles in last year, do you know what I mean? To get the right person to do it. Because everything was disunited because of the MPA.
Yeah, absolutely. If it has a big knock-on effect, you can transitions. Yeah.
Or to go to my vet first, which is not late. So, you know, I can't blame my vet because nobody could see it.
The good thing is by using things like the AI technology, it can be used to pre-purchase examination effectively because it is used, you know, veterinary assessment and farrier assessment is subjective, it's down to personal opinion, that's down to fact, okay, and it's accurate to within 2 millimeters, far more accurate than I could ever look at a horse, and yeah, it removes all the chatter and it just says it is.
But X-rays,
So turn it off.
what do they show? They don't show soft tissue damage.